So, Peter Grant, why wouldn't you operate on those nodes and remove the nodes before chemo?
Conceptually, some people feel that by removing bulky lymph nodes, that you may improve the effectiveness of the radiotherapy by just reducing tumour bulk. That's far from proven. And in fact, I think if these nodes were PET positive, meaning they're likely to have tumour in them, but then still normal size, not more than 2 centimetres, we wouldn't remove them. It's only for bulky nodes you might consider removing them.
And what's the difference in adenocarcinoma and squamous?
I think...
Obviously, Professor Ross doesn't think there's much difference.
The problem with adenocarcinoma is that it's more difficult to diagnose, and sometimes it's harder to pick up these abnormalities early with pap smears because these cancers tend to arise in the glandular cells in the canal of the cervix. And the other problem is by the time they present, they are more likely to be big or bulky tumours. But the treatment that is offered is as effective for adenocarcinoma as it is for squamous carcinoma.
And same stage by stage?
When you're looking at size by size.
Chris?
I think because adenocarcinoma of the cervix is, quite dramatically less frequent than squamous cell carcinoma of the cervix, the data upon which we say stage for stage they're equivalent is not so robust. There seems to be something peculiar about HPV-caused squamous cell carcinomas, which actually makes them more radiosensitive, size for size, than equivalent squamous cell carcinomas. In the head and neck, for example, not all cancers are the same. The smoking and alcohol-related ones are
so oral cancers
more refractory
are also more
to
responsive
radiotherapy.
to HPV. Yep.
If you're HPV positive, they frequently dissolve in situations where you wouldn't have otherwise expected it. So we kind of have a reason for thinking that maybe HPV positive squamous cancers of the cervix should have a better prognosis than adenocarcinoma.
But the data
don't quite know.
And what do you say to a woman, Peter, who says, I don't like the idea of this cancer inside me, I want it out, none of this radiation stuff, just take it all out?
For a stage 1B2 cancer of the cervix, I think the data we have from some of the clinical trials suggests that this is better treated with radiotherapy, chemoradiation, than surgery. And it's really important to try and avoid combined modality treatment if you can, because the complications go up with combined modality treatment.
Claire, what were the questions you wished you'd asked at that first consultation when you were told you were going to have chemoradiation?
I had actually just woken up from surgery and I had a team of, I think, about 15 people come into my room. And Chris was one of them who sat down and told me that because the cancer had spread to the lymph, this was now the plan B. I think they told me everything I needed to. If they had told me that it was going to be as easy as it was with regards to the radiation, I don't think I would have believed them. I thought if you lie there and have this machine go around you and zap you, I would have thought that would be horrendous, but actually that was fine. No side effect really from that.
But the cisplatin.
But the cisplatin, ooh, pretty brutal. Didn't lose my hair, but yeah, I think people always associate chemotherapy, oh, it's horrible, and yes, it is. But no, I think I was fully informed the whole way, which is lucky for me.
And what have you been told about the outcome, chances of cure?
Then?
Yep.
That they were doing it to cure me. There might be some side effects. Obviously, the fertility was going to be one of them, which is why I started IVF that day. But also, there might be problems with the bladder or the bowel in the future. So, but as far as I was concerned, as long as you are alive, you can deal with anything, any side effects that you might have. So I just wanted them to save me, and then I'll deal with everything else later.
So Peter, what are the results
Of treatment?
Yeah, chemo radiation. I should really ask Phil. Chris. Chris, I'll ask Chris.
Yeah.
Chris, what are the results then for chemo radiation?
Excellent. It's difficult because we know so much more about the disease now than we did even a decade ago, and that's on account of extra information we get about staging from PET scans and pelvic MRIs and such. But essentially, localised disease, even bulky localised disease, is eminently curable with radiotherapy and concurrent chemotherapy.
So now most people in Australia are much closer to radiotherapy than they used to with the new regional cancer centres. But there's evidence from radiation oncology trials that for some cancers like head and neck, if you're treated in a small volume centre, your outcomes are not as good. So the question is, have we been sold a pup here that you can get your radiation in Bendigo or Orange, with no, unfair to pick them out, but it might not be as good as going to the Peter Mac or to Prince Alfred or Prince of Wales.
There's no one here from the Department of Health and Ageing.
You are being filmed, Professor Lawrence.
Oh yeah, I forgot about that.
Shouldn't have told you that. But seriously.
So data-free zone, I don't think there's any doubt that access, and access based on the geography of our country, is a huge barrier. And I wouldn't criticise any measures to increase resources that put them closer to people. I think, having said that, that it's probably true that there are some specialised areas of oncology that should be restricted to centres with a certain volume. And I know that the Cancer Australia guidelines, workforce guidelines, came down and made that recommendation.
So is cervical cancer one of them?
Yes, I think it is. And I mean, again, it's a personal bias, but it's based on experience. I actually think it would be very hard to separate the external beam component of radical treatment from the intracavitary brachytherapy component. In my mind, whilst I describe it as a two-phase treatment technique, it's one treatment. It's just using two different methods to deliver the dose.